Hello, I'm Dr. ChiChi Madu, and I'm a cardiologist at Virginia Heart. Today, I want to answer some of the most common questions I hear from patients about what really counts as a heart-healthy diet, as well as coffee supplements and alcohol. Let's start with the best heart-healthy diet. As cardiologists, the diet we most often recommend and follow ourselves is the Mediterranean diet. This style of eating emphasizes fruits, vegetables, whole grains, healthy proteins like nuts, beans, seafood, and poultry, along with healthy fats. The overall goal is a reduced salt and fat diet while minimizing added sugars and highly processed foods. It's also important to keep track of what you're eating day to day. When you consistently follow a healthy eating pattern, it's okay to enjoy your favorite treats occasionally. Heart-healthy eating is about balance and sustainability, not perfection. Now let's talk about coffee. The good news is that most research shows regular coffee consumption is safe for the heart. Coffee and caffeine do not increase your risk of coronary artery disease or atrial fibrillation. That said, everyone's body responds a little differently. Some people are more sensitive to caffeine, and for them, it can trigger palpitations or a fast heartbeat. A good rule of thumb is to keep caffeine intake under about 400 milligrams per day, which is roughly 2 cups of coffee. If you notice symptoms, you should cut back and discuss with your primary care doctor or your cardiologist. Fish oil is one of the most commonly asked about supplements. Some studies suggest it may have modest benefits for cholesterol or triglycerides, but it does not replace a statin if your cardiologist has recommended one. CoQ10 is sometimes used by patients who experience muscle aches while taking statins. Some people feel it helps, but there's no guarantee that it will make a difference for everyone. Now, a quick word about alcohol. There are no studies that show a heart benefit from drinking alcohol. If you choose to drink, moderation is key. Heavy alcohol use has been linked to conditions like congestive heart failure and atrial fibrillation. If you don't drink, there's no medical reason to start. If you've been diagnosed with atrial fibrillation or congestive heart failure, it is very important that you do not drink alcohol or that you limit intake and avoid alcohol as much as possible. Finally, it's important to remember that certain cardiac and other medical diagnoses can impact your cardiologist's recommendations, and those may differ from what I've shared today. That's why it's so important to discuss your individual treatment plan with your care team. If you have questions about how these choices fit into your personal health plan, your cardiologist is always here to help guide you.